Welcome to the World Doc Allen podcast. I'm excited to welcome to the World Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Yes, our topic today is RSV in babies. What is RSV?
Well, it's short for respiratory syncytial virus, and now you know why everybody calls it RSV. It's a virus. It makes breathing troubles in children, especially less than 1 month old. Lots of ads for the vaccine on the TV. And it is the number one cause now of pneumonia and bronchiolitis. Bronchiolitis is, by the way, inflammation of small airways in children. So it's now the number one cause of pneumonia and bronchiolitis in babies and young children. And it's particularly complicated for babies less than 1 month old. There's no test for RSV, and there's no medication, so there's not any real cure for RSV.
Is RSV contagious?
Oh yes, it's really contagious. It can be spread by kissing, sharing drinks, transferring anything mouth to mouth. And the best way to avoid it is washing your hands, covering your mouth, covering your coughs, your sneezes, avoiding contact with people who are sick. And unlike for the flu, you can get RSV at any time of the year. And unfortunately, you can get RSV many times because there's 20 different kinds of Coxsackie virus that can cause this problem.
How do I tell RSV from the flu?
Well, most of the times, the flu will not cause breathing trouble. So the most reliable sign is trouble breathing, and that will only happen in about 2% of babies and children who get RSV. But what parents need to know about trouble breathing is that something called nasal flaring, which is when the nostrils go out like this, and then retractions is another thing. That's when the tissue around below the ribs and on the abdomen gets sucked in because it's hard for the babies to inhale, so they're working hard at it. You shouldn't wait until the lips or fingernails turn blue. That's way too late. And of course, a fever of 103 or so is another reason to go to the emergency room.
How should I treat RSV infections in my children?
Well, for the most part, RSV will be like a cold. So 98% of the children will respond to over-the-counter remedies, like Motrin or Tylenol. Aspirin is not a good one. We've talked about cough medicines before. We had some cough medicines from some other countries with antifreeze in them. So be careful with your cough medicine. And of course, you can put 1 or 2 drops of saline in the baby's nostrils. Now, babies are nose breathers. We call them obligate nose breathers. That means they cannot breathe through their mouths, so it's important. So a drop or 2 of saline, it has to be sterile, it can't be tap water, and then take a blue bulb. And most babies go home from the hospital with a blue bulb. Once you get the drops of saline in the nostrils and aspirate or suck it out with the blue bulb, that is the recommended treatment for management for RSV at home with your children.
What are the risks of RSV problems for my baby?
Well, we talked about this before. The biggest problem, especially if they're less than 1 month old, is that they can have permanent problems with their lungs, like asthma. That's only going to be a problem for 2 or 3 out of 100 babies, but it can be serious. And like I said, most serious in babies 1 to 2 months old.
All right, the best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast, guys. Take care.